Hi, my name is Kaushal Shah. I'm a CEO and founder of a company called eVital. Recently, we launched a new consumer application called PillO, which delivers medications in 60 minutes from the local pharmacies. And we are already live in Ahmedabad, Bangalore, Pune, Hyderabad, and NCR. And we are going live in 5 more cities in over the next 6 months. Since we launched about 100 days ago, PillO, there are a few things that we came across and we learned about it. And one of the thing was there were some repetitive orders from the doctors themselves. These are the doctors that run private practices, clinics, hospitals, part of the hospital. And when we noticed that behavior, we reached out to them and we spoke to them, and we came to realize that there is a big problem that is completely unaddressed, and that is about how doctors would like to actually treat their patients and provide them a great service, such that the patients do not actually have to go and scramble around for medicines, look for medicines. Of course, one of the alternative to do this is doctors having their own pharmacies within the clinic. But we also learned that a lot of doctors actually do not enjoy that. One, it gives a bad perception, a wrong perception to the consumers or the patients, from economic perspective and things like that. And while doctor may be completely honest in his intentions or her intentions to serve the patients correctly, such that the patients can, right after consultation, can actually get the medicines right away and make sure that they make the most out of consultation and the treatment plan itself. The other problem is that, of course, managing a pharmacy is not fun either, for the doctors at least. Managing, human resources, products, inventories, GST compliance, invoicing, expiries, other compliance issues. So doctors do not always want this, but they end up having this to make sure that their patients don't have to either suffer in terms of looking for medications after consultation, make sure that the patient can actually adhere to their treatment plan, and also make sure that the patient go for the medications, the brand, the quality that the doctor relies upon or trust upon, so that there is no compromise. So considering all this feedback, all these discussions that we have had with the doctors, what we decided to launch, what we decided to build is to something to help the doctors, where doctors can actually also help their patients to get the medications on time, without having to run the pharmacy. So, over a few years, for those who know us for what we do, we built one of the largest pharmacy network in the country, completely on cloud. That is about 7 to 8,000 pharmacies across the country. And using this network now, we are providing APIs and portals to insurance companies, corporate wellness providers, and now clearly about doctors and clinics as well, such that they can actually place orders for their patients. That ensures that correct medication, and ensures the timely delivery, adherence to treatment plan, and of course, a really, really high quality customer service. What I want to do is I want to spend a few minutes to show you the portal. It's very, very simple. It's designed for doctors and their staff. And here it is. Without further ado, let me share the screen and we'll go through that. So what you see here is a portal that a doctor or their staff would be using. And while I already logged in, there is a login for that. Once they log in, basically shows you the screens of listing of the prescriptions where they can actually add a new prescription. So let's say a patient comes in and patient just finished their consultation. Doctor is okay while writing on the prescription pad that can be digitized by their staff. Um, Here, I want to pause for a second and also mention that we do integration with EMR companies as well. One of the company that we have already integrated with, it's called ECA. So if you're a doctor using ECA or thinking about getting an ECA, I strongly suggest that, especially if this also entices you. If there is an integration done with the integration with the ECA is already done. If you use a particular EMR and if they're open to an integration, we will be also more than happy to do the integration. But let's say even if there is no integration, I can walk you through the procedure that would look like. So they will say add new, where they will basically add a patient address, patient number. Once the patient number is typed, if the patient has a history at your clinic, it will pop up automatically. Assuming that there is no integration, you will be required to upload a prescription. If there is an integration, this step will be automatically skipped, and you will actually already get the item names as well. But because we are going through a non-integrated flow, you can upload a picture of the prescription, Go next. If there is a patient address as well, let's say we have done this thing before, of course, it's already there. If not, you can actually add address. We can actually locate on map. So let's assume for a second that I'm a doctor or the staff that works at the clinic. I can locate it on myself, or I can actually also send a link to the patient, assuming the patient knows their address better to do it on their phone. Let's just for sake of a demo, we'll also do locate on the map. I'm going to put our office address here. Is the office address, confirm location. It's all good. Once I am done, we will actually verify that that location is actually serviceable or not. And it says address is added successfully, and it's basically checking that whether we can actually deliver, medicines in that neighborhood, in that location or not. Once that is done, you can open the prescription portion. The prescription is already there. The patient is there. Like I said, this is a non-integrated EMR flow. So there is no item names here. There are prescription here. You can zoom in and zoom out. But let's just go ahead and for the demo first, I'm going to pick few products and I'm going to type. So this is the doctor typing this medicines or the patient digitizing the prescription. And once I add something else too, I can add a couple products here. As you can see, imagine there is something called, there's a percentage next to it. It basically shows you a score, how popular the items are. A lot of times as a clinicians, we tend to remember the products that might be, very popular in the past and then have somehow been discontinued or something in the market. So to make sure that our patients do not suffer through these issues, we actually also show you how popular their products are. So because we already added 2 items. So here is the fun part. Address is there. Everything is there. Once I click on check availability, we run APIs and we make sure that based on the patient address in the nearby pharmacies, are these products actually available or not? So as a doctor, you actually do not care which pharmacies you are dealing with, because that is where we come in. We make sure through our APIs, through our technology, that these products that the doctor has prescribed, are they available nearby in the pharmacy where the patient is living on that address. There are 2 options that are given. Quick delivery, which is 60 minutes. If I click on 60 minutes delivery here, same medicines, it will say, basically it says partially available. What that means is one of the medication is available, as you can see, LTKH is available. However, the other product that I have prescribed, Telma ATH, is actually not available. So what are the other options I have? I do have another option which is available, but hence there will be one brand that will be changed to some other brand where they can actually make it available. If as a prescriber, if I'm okay with it, I will simply click on that button and say submit. It will actually automatically swap out. The total will be displayed here. What would be the cost to the patient? Now, doctor has 2 options, or the staff has 2 options. They can actually send the payment link directly to the consumer, the patient. If the patient is proficient enough to place a pay online through UPI or something, they can do so. If not, they can actually buy credits with us. So when I say they, I meant the staff, the clinic, the doctor can actually buy credit from us, and they can actually pay on behalf of the patient, and assuming they will be collecting 298 rupees along with the consultation fee from the patient. So now there are 2 options. Either one, we are okay with it, of course. Once that is done, the order will be placed. Once the order has been placed, order status and everything will be shown here as well. So you as a staff can actually can actually see the status of the order, the payment links, the receipt, the invoice, the tracking links, and everything will be shared directly with consumer or the patient as well. A patient can also track it. You can also track it in case patient is not proficient. They can call you up. You can also do that. So imagine what we have done here. What we have done here is we basically provided a complete network of the pharmacies to the doctors. So if I'm a doctor in practicing in one part of the city, in Ahmedabad or Bangalore or anything, and if my patients are coming from other part of the city, I want to make sure that they get the medications delivered at their home, most likely, or a lot of times, very likely, before they themselves get home. And most importantly, even if there are refills that need to be done later on, a week or 10 days from now, 15 days from now, they can also make sure that the products are available from their local pharmacies. By the way, the really awesome thing is patients can actually also call you back in 15 days and you can actually place an order for them right here from this window. You can actually search the patient name and you can place it on their behalf as well. There are a couple of small things I want to mention. We're open to a lot of feedback. I'm sure there's going to be a lot of feedback. So please have that on our way. A couple of other things, you can actually create staff members. You can actually manage their staff profiles as well. What do you want them to be able to do and so on and so forth. Lastly, you can actually buy the credits that you need to buy credits for. And you can also, whitelist your items that you want to. Let's say I'm going to go to doctor, and if I have, so let's say Dr. Nitesh B, I have some KYC, and then medicines. So let's say I'm a doctor and I would like to only prescribe from certain brands only. I can actually also do that. So think of it this as a whitelisted brands, whitelisted items, or whitelisted medicines, so that I can actually make it very, very easy for switch from or prescribe from. So some doctors are open to the alternatives as long as it's within their favorite list. So you can actually whitelist all these items right here from the beginning. So you can actually do that from here as well. And you can, one thing I forgot to mention, actually, let me go back. There's a really cool thing here as well, which is, let's say as a doctor, if I do not know or do not have a very specific brand association that I would like to prescribe, but I'm very well clear about some content, some medicine API that I would like to prescribe. I can actually type C comma and start typing the content name and API name, telmisartan, and all the products with telmisartan as a content will also show up. So this is out there. We are already live. If you are using EkaCare, that's awesome. If you are using any other EMR software, we can also look into the integration with them. If you're not using any EMR, or if the integration is not possible for whatever reason, you can still go ahead and do this. At the end of the video, there will be a number that will be that is one of my colleague Nitesh. You can, or somebody else as well. We will be sharing the contact details. You can reach out to us. You can DM me, and we'll be more than happy to give you this access and walk you through this thing. Hope this is helpful to you and your patients, and we want to make sure that we make medicines accessible and affordable to every Indian citizen. Thank you.